COVID-19, the deadly virus which has spread to every continent on the globe except Antarctica. So how could coronavirus start to affect you? Our science correspondent Thomas Moore is here alongside an expert panel of guests to answer your questions this afternoon. We have retail analyst Kate Hardcastle, Senior Clinical Lecturer at the University of Exeter, Dr. Bharat Pankania, and Simon Calder, Travel Editor of The Independent. We'll be seeing them shortly. I'm going to talk to Thomas first, though. Thomas, lots of people getting in touch with their questions. Let's first talk about the World Health Organization earlier on saying the word pandemic is not helpful and it's likely to inflame the situation. But we heard the Health Secretary earlier on, Matt Hancock, in the House of Commons, giving us an update, using the P word a lot. The EU, their processes, they're calling it a pandemic as well. Paul Connew on Twitter asks, has the time not come for the WHO to classify coronavirus as a pandemic, given how we've seen it spread in the last 24 hours or so?
Well, certainly some doctors I've spoken to have called this a pandemic in all but name. It clearly has a dictionary definition. It is global spread of a severe infectious disease, and many people would say we've reached that point now. The World Health Organization is very cautious about calling it a pandemic because it got into a lot of trouble back in 2009 with the swine flu pandemic, that a lot of countries were waiting for the call, which didn't come for a long time and therefore delayed action and so on. This time round, they're not going to get into that hot water. What they're saying is that each country should be able to make a risk judgment for themselves on how bad the outbreak is in their country and take the appropriate action there.
It's interesting, a lot of people getting in touch saying, you know, the message from the Health Secretary, Matt Hancock, essentially was keep calm and carry on when he spoke to Commons this afternoon. And the advice being drummed into people is if you're in doubt, call NHS 111 and self-isolate. What does self-isolating mean? It's
a really good question. I mean, at the moment, the test is a swab of the throat, of mucus, and that is looking for genetic material from the virus. So it will identify people who've got an active infection. If that result then comes back as positive, you'll be asked to stay at home for 14 days. That is the period that you are thought to be infectious for. And that essentially will mean that you do not go out, you don't go to work, you don't take public transport, you don't pop to the shops. You can, though, still have deliveries made to your home. So friends and relatives can do your shopping for you. You can still get somebody to bring a takeaway around. Those kind of things can still go on. But you should be minimising contact with other people, because the longer you spend surrounded by other people, the greater the chance that you'll be passing the virus on.
OK, Thomas, let's bring in our panel that I mentioned before. We've got an expert in travel, an expert in business and retail, and a public health expert as well. Simon Calder, our travel expert, I'll come to you first. We've just heard about that Six Nations rugby game in Dublin being called off, so people probably going to travel to Dublin will think twice. I've got a question here from Nicola Beveridge on Twitter. She says, I'm going on a cruise on the 6th of March. I fly via Edinburgh, Heathrow, Rio in Brazil. Brazil, of course, confirming its first case. Then I go to Tenerife, Lisbon, Cadiz. I mean, this sounds like an incredible cruise. She says, should I cancel? Because she's effectively hitting every hotspot here. She says, though, if I do cancel, I lose around £4,000.
Of course she shouldn't cancel. What a wonderful opportunity, but I would be so careful. You are going through the busiest airport in Europe, London Heathrow. You'll be changing planes there, and airports are the places that I reckon present the biggest biohazard. It's a microbiological party. Everybody from around the world converges with their own personal germs, and they all get mixed up, particularly in the security area. At airports, be really careful in terms of not getting too close to people. I know that's difficult when you're in queues, and certainly after the security search, particularly if you've been handling the tray that you put all your liquids and your phone in, go and have a good old wash and with proper soap and water, because that's probably the biggest danger you're going to encounter in your entire wonderful holiday. And then just things like keeping a distance from anybody who looks ill, which you'll do anyway because you're a sensible person, and if you can, pay for food and drink with contactless rather than handling cash. But apart from that, it sounds a great trip. And look, I must pick you up. You said hotspots. Well, yeah, there's some unfortunate cases in Tenerife, but the chances of any of us going to places where there are cases and actually being in proximity with people who've got the virus long enough to catch it are thankfully extremely low. And even if you do pick it up, I would say the biggest danger for the vast majority of people, leaving aside the cohort of over 70s and people with unfortunately weakened immune systems, the biggest danger is that you bring it back and you spread it. That's what worries me about it, not actually having the nasty, but for most people not fatal virus.
Yeah, Thomas nudging sagely along there, because we keep hearing about NHS 111, we keep hearing about self-isolation, but personal hygiene as well. We can't emphasise that enough. Thank you, Simon. And Nicola Beveridge has just tweeted me a few minutes ago. Kate, this could... Oh, no, this is Hannah. I beg your pardon. Hannah Kelso. This one's for you, Kate. It's about employers' duty of care. Hannah says, I'm a university student doing a clinical placement at a large hospital for 40 weeks this year. What are my rights in terms of going to a placement during a pandemic? And what is my employer's duty of care towards me?
Well, I think an important note is that we've got information through that many people are being asked to take this 14-day isolation period. And there's certainly some questions about where people stand. It's very important to speak to your employer and understand your contractual rights when it comes to things like this, because unless you're actually sick with an illness, you might not get the sick pay you think you're due, and you have to speak to them. Many big businesses will be able to make the decision that they're going to treat the welfare of their staff, both at the office or at work, at place of work, and at home equally as well, and they will probably cover that 14-day period. However, it's not always the case, so important to check that detail. Also, work with your organisation to see what information they need from you, how often they need you to update them, speak to them constantly, look out for notice boards, information briefings. And another quick point to mention as well is actually if you are in an isolated period of 14 days, if you can work with your organisation, perhaps do some work from home for them, or look to be actually responsible in trying to deliver on your work still whilst you're off work. Not always possible where we've got roles that are completely reliant on placement of your activities, but it's important to speak to your employer all the way through.
Dr. Pankani, I've got a question for you. A lot of people very concerned about a leaked UK government document talking about a reasonable worst-case scenario when it comes to coronavirus. A lot of people talking about this on social media. Perhaps you can shed some light on it. It says in this reasonable worst-case scenario, 80% of British citizens could be infected with the coronavirus COVID-19 and around 500,000 would die. Can you put that into perspective for us? Is there some truth in that?
Oh, we're happy to do so. I haven't looked at this leaked document, but thinking empirically and from first principles. So if I was given that scenario, my answer is very straightforward. It's easy to answer. So this is a new virus, and because it is a new virus, we expect people to get infected. That's nothing new. That's not a big deal. I want to reassure our listeners, which is this, and you've heard it before from our other commentator, that most people who get infected will get better, and most people will suffer a mild illness. Only a very few numbers will actually need to see a doctor, and fewer still go to hospital, and fewer still go to ITU. Now, when we talk about what is a technical term called case fatality rate, it means of those people who become ill, how many go on to die. And when you are talking about large percentages, large numbers, and then a small percent of a very large number, obviously it sounds alarming that, goodness me, are so many people going to die? But if you put it into perspective, with the seasonal influenza infection, a lot of people die every year from seasonal influenza infection, which, by the way, is preventable. So we need to have that perspective, and when you start thinking about large numbers, it's unnecessarily worrying, and I would want our listeners not to be.
Doctor, can I just ask you a question? Because we're seeing here a lot of effort being taken globally now, driven by the World Health Organization, to try and contain this virus. If flu is a much bigger problem every year, we let that go by. We don't take this extreme action. So is there something we're not being told about this COVID-19 outbreak?
No. Why would we want to lie, and why would we want to not tell you the truth? My University of Exeter has never censored me, and I don't have a brief of go here, go there, or don't go there. So let me share with our listeners what I would like to share with anyone, which is the reason why everyone is excited and concerned about it is because this is a new virus. This has emerged in China and is now spreading to cause illness. And the excitement and concerns are because it is new, it's brand new. And because it's brand new, we don't know a lot about it. To put it in context and give a balancing act for you, I would say the coronavirus appears to be a little bit worse than the seasonal influenza virus, but it's only a little bit more worse than the seasonal influenza virus. It is not something completely different, which is going to be a shock to the system. We don't see that evidence. So I hope I can give that reassuring messages for our listeners
Simon,
and viewers.
Simon, another question for you. It's interesting, many people getting in touch saying, look, I'm looking at what's going on. I've planned a holiday, say, to Tenerife or Italy. And even though the risk might be low and the government is saying you can still travel to those areas, I just don't want to go. So what are their rights?
Well, you have none, effectively. I mean, there's a slight, there's a few odd cases. So, for instance, if you were going to the rugby in Dublin and you booked a package that included match tickets and it was clear that you were going there for the purposes of seeing a rugby match, same applies for Italy, England in Rome, then you would be able to claim a full refund if the match doesn't go ahead. But for everybody else, and I've talked to lots and lots of people, I've never known quite such concern about this, going to Florence, going to Venice, going to Milan, how lovely, skiing in the Italian Alps, absolutely great. The travel industry's attitude is, we're still flying, your holiday still exists, there's no Foreign Office warning against going, disinclination to travel doesn't cut it, doesn't mean anything, you'll lose most or all of your money, and your travel insurer will not be interested either. That sounds really harsh, and I'm sorry about that, but that is the attitude. The only flexibility I've seen so far is British Airways is saying if you're booked to go to northern Italy in the next week or so, you can postpone, but only till the end of March, and a lot of people won't be happy with that. And of course, if you've got flights, car rental, skiing booked on top of that, then that's not going to help either. So it's a very blunt, the holiday is going ahead. If you don't want to, tough luck, I'm sorry.
Yes, tough luck, but, you know, sound advice. Those are the facts for people to get their heads around and make those decisions. Kate, let's get back to retail. And what's going to be the knock-on effect? Are we looking at, people are asking, shortages in British shops because of the disruption in China and perhaps potential price rises as well?
I think it's really important to set the scene when it comes to China. Quite understandably, a lot of people just can't understand quite how much of our products either come from China or indeed have component parts that come from China. Indeed, it was 20 years ago when I started working in the factories there that only then could I understand the size and scale. Now, what's happening in the factories in China is there's a complete shutdown, and that includes 14 days then of quarantine for workers to get back, many who actually live there. So production is hugely affected. And to also put some perspective on this, the retailer Walmart, one of the biggest in the USA, has 25% of its products that come from China. We already have heard there's profit warnings and challenges, and certainly stocks and shares have seen the challenge as economists try and get to grips with just how long this knock-on effect is going to happen. So certainly when it comes to the supply chain reliant on component parts or products from China, there is probably going to be some shortages because that shipping takes 8 to 10 weeks to get to the UK if it's on the seas, shorter if it's by air. Also, you've got to think about then the prices that these organisations are going to have to take into stock with the fact that they're having to catch up with what's been a very challenging period. I don't think, Sarah-Jane, we've seen the full effect yet, because what happened with the beginning of this outbreak is it was actually at the same time as the Chinese New Year, one of the only times those production sources actually closed down. So be very aware. Also, do start to watch stock shortages, things like panic buying on anti-bac wipes and antibacterial liquids. When it comes to the economy generally and businesses, yes, there's going to be a knock-on effect, and that's not just because of that. That's because this is an economy that's already faced challenges of political unrest, things like Brexit coming into it. It's just not as robust as it could have been. And that means that another thing that was unplanned for, couldn't even be speculated for, is causing a lot of headaches and challenges. So definitely be aware of your finances and the implications.
Dr. Pankania, a lot of concern about the fact that people are saying many people can contract COVID-19 and be completely completely symptomless. How dangerous is that in the spread of this? Because obviously, if you haven't got any symptoms, you may not feel that you have to self-isolate. And does that make this a bigger problem than we currently know about, do you think?
We don't know a lot about the new coronavirus range of signs, symptoms, infection pattern. Having said that, of course it is difficult. It is extremely difficult if you are without symptoms and yet infected and infectious. It makes our lives very difficult to contain it. Look on the positive side. Thus far, we are succeeding in containing it in the United Kingdom. Second point, if you are infected but without symptoms, that's telling you the story straight away, which is a lot of people will get infected and a lot of people will be well, even with the infection, and they will make a full recovery. So that's also, in a roundabout way, a reassuring message that whilst my job, our job of containing it, keeping it away, keeping the numbers down, making sure that our health services are not overwhelmed with too many cases, all those things are very difficult. But the reassuring message for people, our viewers, is in most cases, for most people, they will make a full recovery and most people will not be very ill.
Thomas, it's interesting, a lot of people getting in touch saying, you know, they know about NHS 111 self-isolating, but they're saying, if I'm worried, how can I get tested for COVID-19?
Well, you'd have to fall into one of the categories that you've been to one of the affected areas, that you've also showing these flu-like symptoms. That's when the NHS would swing into action. They'll either ask you to come down to one of these pods outside hospitals where you can be tested without infecting other people in the waiting room, or now we've heard today from the Health Secretary that they're going to start piloting home testing. So a team will come to your house and do the test again, so you're not encountering other people on the way. And that is really what the NHS is trying to do, to limit this, the spread of the virus from people who might be affected.
Simon, Jenny's got in touch saying, what if you've got relatives in one of these quarantined areas, particularly in the quarantined hotel in Tenerife? What kind of information are they getting? What kind of support should they be getting?
Well, of course, we've heard some stories overnight of the people being without food and drink in their hotel, and I imagine that the Spanish authorities are dealing with that fairly quickly, because clearly that cannot continue as it is. There's so much anxiety and stress and worry in and around that hotel, but I think your question actually is goes wider than that, which is that people are seeing that there are these quarantines going on. We saw, of course, the Diamond Princess ship in Yokohama, as well as the H10 hotel in Costa Adeje in Tenerife. And people's alarm, certainly in terms of those who've contacted me on social media, is now veering towards, well, look, okay, I might not contact the virus, but I'm really worried that I will be kept in quarantine, and I can't do that because family depend on me. I've got to get back to run my business. There's all sorts of reasons why people simply cannot afford to be delayed abroad. If you've got a holiday, that, of course, is something that you will be taking into account. And I must say, it would be interesting to get a medical view on this. Keeping people incarcerated on a cruise ship or inside a hotel, when actually the people who very sadly have had the virus that we know about have been through airports, going out to restaurants, enjoying excursions, all sorts of things. So to keep people who may be on the 17th floor when the unfortunate Italian doctor was on the 6th floor, I'm not sure how much use that will be in restricting the spread of this, and most certainly it is causing a great deal of worry, and well, what an awful thing. There you are in one of the loveliest islands in the world and you're stuck inside a hotel.
And this has just come in from Aurelia Lupton. This one will be for you, Doctor. She says, what's the survivability of the virus on surfaces? Because we've seen a lot of schools be deep cleaned if somebody's been in there that's suspected to be infected. How long can this virus survive on surfaces?
Reasonably good question to ask, and the answer would be it depends on the humidity. In other words, the moisture in the air. So in dry, warm, hot places where the virus may have landed from nasal or mouth secretions, it dries out day natures and it becomes ineffective. So warm, moist, wettish places, its survival period is longer, and in dry, soft cushions, fabrics, where it dries out a lot faster, it's not going to survive for longer.
Okay, Dr.
How many
Pankhania,
hours?
That's all we've got time for. That's our expert panel answering your questions on COVID-19. Kate Hardcastle, Dr. Pankhania and Simon Calder, and of course Thomas Moore. Thank you very much.